So next up, guys, oh, this is on, Dr. Akiko Tomonari.
Okay, I'm going to talk about gut health today, which is quite important to keep in Hanoi. So first of all, I'd like to introduce myself. My name is Akiko Tomonari, and I'm the gastroenterology specialist here. I'm Japanese, but I grew up in British Hong Kong and in the States. I did my medical training in Japan and briefly in the US as well, and I have worked in China before coming here. And I've been at Hanoi French Hospital since the summer of last year, so a little bit over a year now. Now, I'd like to talk first off about why gut health matters. Gut is a very important location for digestion, as you know, but it also controls a lot of the immunity and even mood. There is a substantial immune system in the gut. We even have a special name for it. It's called gut-associated lymphoid tissue. Around 70 to 80% of whole body's lymphoid system is located in the wall of the gut. It has a very comprehensive and complex system, and it controls bacteria, viruses, parasites from entering the whole system. So it is the first gate that things need to pass through, and that's why there's so much protective layer of lymphoid tissue in the gut. Now, there are some more common gut issues in Hanoi compared to others, and the first is gastritis and ulcers. The second is diarrhea, as I think everyone has experienced 1 or 2 episodes of diarrhea in Hanoi. So I will talk about these one by one in the following slides. And first of all, I'd like to start off with gastritis and ulcers. And there's a big reason for that, why this is very common in Hanoi. And the reason is the prevalence of Helicobacter pylori. It's an endemic in Vietnam and also in other Southeast Asian countries. And it is a very unique bug in the way that it lives only in the stomach. It doesn't go to spread in the whole body, so that's why a lot of people do not realize that they are carrying this. So there are a lot of carriers who have no symptoms. They live together with a bug for years and years without knowing that they are infected with this bug. There is no accurate data from Vietnam. This is an estimate from other countries, but it is said that around 50 to even 80% of the population here may have this bacteria. And the infection route is through saliva and infected water. Is the most common route is through mother-child. Children need to be fed. Mothers put the spoon in their mouth and then take the food and shove that spoon into the child's mouth. I think this is a very common scene, and it is passed on to children who have less developed immune systems, and they are more susceptible to getting the bacteria. The second is a communal eating culture in Asia. There's food in the middle, everybody takes food from there. If they put the spoon in their mouth and take the food with using that spoon, then that food is already infected. Everyone else in the family gets the infection. There's also the street food and canteen culture. Infected waters, this is a very big problem because you can see if you go to Old Quarter in Hanoi, they have basins of water that they use over and over again to wash dishes and cups. If the previous user of this glass had Helicobacter pylori, then this basin of water is already infected, and all the plates that have been washed in that water have Helicobacter pylori in it. It's very difficult to be careful about this if you're eating on the street. Some of the symptoms are more chronic than acute. Acid reflux, discomfort in general, bloating, even pain can be a sign for H. pylori infection, so it would be better to test for it if you think you may have one of these symptoms. Gastroscopy is not always recommended even when you have pain or bloating. I do not recommend it at the first visit unless the symptoms have been over 3 months and H. pylori is negative. If H. pylori is negative, that means that I don't know what is going on. There's nothing that I can blame for the symptoms, which means that it might be better to dig further with a gastroscopy. If the treatment is resistant to HP, some of the H. pylori bacteria have a high resistance here, and even if we treat, the H. pylori is persistently in the system. Then we need to go inside and take a look at the stomach to see, is it causing damage? How much damage is it? Is it irreversible damage, or is it something that we can fix? If there's significant weight loss, persistent nausea, vomiting, lack of appetite, then we might want to do a gastroscopy to check if there's any underlying reasons for that. Now I'm going to go on to diarrhea. First off with chronic diarrhea, including IBS. And talking about the chronic symptoms, I cannot avoid talking about the gut microbiome. There are trillions of bacteria that help to digest fiber, make vitamins, regulate immunity, regulate mood in the gut. And balanced microbiome means better health. This is very important. And dysbiosis can be linked to obesity even, something that seems unrelated to the digestive symptoms like diabetes, and of course something like IBS, inflammatory bowel diseases. This can be triggered by an imbalance of microbiota. There is another thing that I need to mention, which is called the brain-gut connection. Gut and brain constantly communicate, and the gut and the brain is very closely knitted in the way that we have found out in the recent years that gut is one of or maybe the only organ that gives feedback to the brain. So if the gut is not happy, you could be unhappy. Maybe prior to this, brain was thought to be the commanding center of the body, sending signals to all the organs saying do this, do that. But the gut seems to be telling back to the brain what you need to feel, how you need to be, what you need to be doing. Irritable bowel syndrome is a very common diagnosis. Actually, the diagnosis process is very complicated, but it is a diagnosis that is very easily given. So we need to be careful about the diagnosis here. But if you are definitely diagnosed with irritable bowel syndrome, this is very closely associated with this gut-brain interaction. So it's very important to control stress. I think Dr. Allison will be talking about that later. But for IBS, psychological balance is extremely important, sometimes even more so than taking pills. Stress worsens reflux, stress worsens acid production, stress worsens IBS. So it's very important to have a good mindfulness when you're living in a high stress environment like Hanoi. Good sleep and relaxation supports digestion overall. Of course, for IBS, it can, so it's very useful to do meditation. It's useful to take vacations. Sometimes people go on vacations, they feel fine. The moment they land in Hanoi, they feel badly again. This can happen because of this interaction. What can we do to help out? Aside from having good mood, we can try to eat more fiber and fermented foods. Fiber is known to actually lower even colorectal cancer risk. We need to eat 25 to 30 grams of fiber per day, which seems like a lot, but it is achievable if we're eating a good balanced diet. I'm mentioning some of the top 10 high fiber foods that can be found. You can see that some of these foods are so-called superfoods like chia, flaxseed, quinoa. You can dump this into a salad or a smoothie, and it'll be very easy to take 25 to 30 grams per day. Fermented foods increase the microbiota diversity. It has anti-inflammatory effects, something like yogurt, kefir. In Japanese food, we have a lot of fermented foods like miso soup, kimchi, magori is alcohol, but it's fermented. And some of these are very useful in promoting prebiotic, probiotic effects. But one thing we need to watch out is salt content, because a lot of these fermented foods do tend to contain high salt, and so it's better to watch out for that when eating fermented foods. Secondly is the acute aspect of diarrhea, which is associated with parasites and food poisoning. And some of the parasites that is commonly seen here are two kinds. One is called flukes, and these are most commonly infected through crabs, snail, undercooked fish. The second is so-called worms. Those are physically worms, and they are infected through dirty waters and unwashed vegetables. So to prevent the infection, first thing I would like to avoid, along with the Helicobacter pylori infection, is try to avoid street food. And second is what you can do at home would be food preparation for cooking. Obviously, wash vegetables and fruits thoroughly. There are some non-toxic detergents that you can find online that contain vinegar or some natural substances if you want to be extra careful. And you can soak vegetables and fruits into those before eating if you like to be very, very careful. Another thing that's quite important is to make sure the center of the food is cooked, especially when reheating with a microwave. It's very difficult to see if the center of the soup is at boiling temperature, which is the temperature that it needs to reach to make sure that no bacteria that has started to grow in there is not enough to actually cause symptoms. The optimal temperature for bacteria to grow is around body temperature, which is around 35 to 40 degrees. So let's say the soup looks like it's boiling in the microwave on the surface, but if the center is 40 degrees, then it's the best temperature for the bacteria to increase, and if you eat that, you would definitely get food poisoning. So it is better to put it in the microwave, take it out, kind of swish it around, and then put it back in to make sure that everything is reheated. And lastly, it's better to separate cutting boards and knives for meat and vegetables. Personally, I have 2 cutting boards and 2 knives, and I write vegetables and meat on the cutting boards to make sure that I don't mix them up. If you only have one, it's better to cut the vegetables, prepare those, put them to the side, and then go on to cook the meat, especially if you're cooking something raw like salads. Now, medical habits are also very important, and I would like to mention a few things that seem to tend to happen in Hanoi. One is a usage of casual antibiotics. People get diarrhea, and they just go to a pharmacy, and the pharmacy sells them antibiotics. In other countries, this is very difficult to obtain, but here, antibiotics can be bought without a prescription. And sometimes people don't know that they are antibiotics and they are taken. So it is better to check exactly what they are. Are they antibiotics or not? Some diarrhea bacteria will get worse if you take antibiotics. So it's better not to take antibiotics casually. They also disrupt the microbiome, and it may build resistance, which means that antibiotics will be ineffective when you really need them. Second are PPIs. This is esomeprazole or meprazole, something with oprazole in the end. This is also very frequently given at pharmacies for stomach problems, but this should be taken only when needed. And if some people are taking them long term, it's better to review why you need them and do you really need them. The last is exercise. As mentioned in the previous presentation by Dr. Pravat, it's very important to exercise and keep a healthy weight for the gut bacteria as well. The aim BMI from the gastroenterology perspective is between 19 to 25. And extreme diets to lose weight is also unhealthy because it will cause an imbalance of bacteria. And lastly, supplements. They are important in some ways. If you need them, you have to take them, but they are not cures. So some people depend on herbal supplements and these vitamin pills, but they are not enough to maintain the microbiome. Balanced diet and healthy exercise is more important. Now, lastly, I'd like to talk about screening checkups. It's always better to catch things earlier than later. Colon cancer screening is recommended at 45 years old per guidelines US. The rest of the world, a lot of countries recommend 50 years old. There are 2 ways to do it. One is a stool test called the FIT test. But now more and more a colonoscopy is recommended even if you're completely asymptomatic. If you reach that age, it's better to consider a screening colonoscopy. H. pylori testing, especially here in Hanoi, it's better to do one if you're feeling some symptoms. We can do it with breath tests, stool tests, or blood tests at this hospital. And if gastroscopy is necessary from other symptoms, then I can test during the gastroscopy. Early diagnosis always has better outcomes, and now with current technology, early cancers can be cured without opening the abdomen up. We can go inside, cut it out, and done. So some key takeaways: please eat more fiber, fermented foods, wash well, cook well, and choose where to eat. Don't misuse medications. Please do some screenings if you're hitting that age, and try to reduce H. pylori for yourself and others. Lastly, if persistent symptoms appear, do not hesitate to see a real doctor. There's a reason why I'm saying this, because so many people are depending on Dr. Google and Dr. ChatGPT, and they cannot diagnose HP for you. You need to come in here and do the exams. So if you're feeling unwell in general for more than 2 weeks, I think it's time to see a doctor. So please remember to do these things for prevention, but if you're already having symptoms, please do not hesitate to come in. Thank you very much.
Guys, any questions for Dr. Tomonari? Yes.
I have a question. I was a bit saddened by the fact that we should avoid street food. Is there any type of street food that's less risky to eat than others?
Yes, definitely. For example, street food that is in stalls, like those push-around carts, they do not have a water source. And they usually, I check them out, but they usually borrow water from nearby cafes. They get a pail and they use that over and over again. So I do not recommend those. But for shops that have actual, like a storefront and are heated, like pho. Pho is relatively safe because there's no raw things in there. Even if it has H. pylori, for example, as long as the soup is boiled and the noodles are boiled, theoretically it should be free of any bacteria. So I would recommend restaurants that have a storefront, not those push cart around, and those who have the food is well cooked.
Asymptomatic H. pylori carrier, and do you recommend asymptomatic screening ever?
Yes. The first question is yes, you could be an asymptomatic carrier. Actually, a lot of people here get infected with HP when they're a child, and the body gets used to coexisting and carrying this around that they don't feel it anymore. So that's the problem with H. pylori, that they are not feeling anything about it, and they give it to other people. H. pylori screening is done in Japan as a screening program to prevent more spread, because we know that H. pylori increases the risk for gastric cancer by 10-fold. So it's a part of gastric cancer prevention program. Here, I don't think that is done. In the US, no, because the prevalence is much lower, but it is useful to know if you have it, especially people with children, because as I mentioned previously, children are more prone to susceptible to get them. So if the parents have them, it's better to eradicate before they pass it on to their children.
And how do you eradicate H. pylori?
Here, I have some medications that I can prescribe, but it's usually 2 weeks of antibiotics. So it's a lot of medication, but yes, that is the only way to treat.
Non-invasive either. So.
Right, non-invasive either. And as long as you take the medication, it is treatable, and you're preventing long-term bad things happening to your body, the most of all gastric cancer.
There's a tradition in Vietnam, I've lived here a long time, that everyone takes worming tablets once a year.
Yes.
It's on clockwork once a year. All the Vietnamese people here will know about this. How much of a risk is that actually? Is that founded in sort of, is that just something that people do as a positive tradition, or is it necessary to take deworming tablets once a year?
Yeah, so I've looked into this because I do get that question a lot. There is no clear recommendation or guideline recommending this from a medical point of view, and it's more traditional. But on the other hand, depending on what the deworming tablet is, actually there's not really a big side effect of taking the tablets if it's like once or twice a year. So I do not recommend against it, but guideline-wise, medically-wise, there's nothing that I can say that is based on evidence to recommend it either. Yes, so I think a lot of people do it, and I wouldn't say, oh, why are you doing that? It's not like the PPIs or antibiotics where I would definitely, recommend against.
That's good. I mean, I've taken them and I have no worms, so.
Great, yes. So here we have one person.
Amazing. Yes?
I was taught that I need to wash the chopsticks with lemon before using it to eat the pho. So I was wondering if that's real in terms of in medical perspective.
I see. Oh, that's a really good question. Actually, I've never heard of this. I think it's more of like a traditional way to try to prevent, because lemon is acidic and it has some anti-infectious effects. In terms of HP, I think that's not enough. It needs to be washed with a proper detergent, but maybe it's better to do that than not do that. So I need to look more into that. That's a really good question. I will research about it. Thank you.
Does it make the noodles taste better?
Maybe.
Then do it.
Some restaurants have boiled water when you can put your sticks before starting your lunch.
Yeah. Yeah.
You can boil them.
Yes. Boiling is definitely a good way to sterilize them.
Hot pot is totally.
Hot pot is communal eating, but if it's boiling, then yes.
Interesting. Great. Okay. Oh, one more. Yes.
すみません、日本語でいいですか？
はい、どうぞ。
はい、英語ではちょっと話せないので、
はい。
娘はHBO がかかったことがあります。
はい。
でもその後ネガティブになって、今ママとしては毎日の料理に何を注意すればいいですか？
はい。
はい。
I'm going to translate first. So her daughter has been diagnosed with HP. It's been eradicated successfully, and she would like to know, as a mother, what she needs to be careful about for preventing, or what she needs to be careful in general. まず英語で答えます。はい。HP is very unique in another way that it's very unusual to get a second infection. So once you get infected, you get treated and confirmed that it's gone. It's very rare. Around 2 to 3% of the people will get a second infection, but usually not. So once you get it, it's like getting a vaccine. You don't have to be as careful, but it would be, useful to be careful about washing the dishes, carefully washing the vegetables, just a general precaution that I mentioned. 1回ピロリにかかると2回目かかることはとても稀で、2から 3% ぐらいの人しか2回目かかりません。はい、なのであまり注意しなくても大丈夫なんですけれども、ちゃんとお皿とかコップを洗ったりとか、野菜をしっかり洗うとか、今ちょっとお話しした内容で十分だと思います。Something separate. And of course, boiling is effective, but yes, washing thoroughly actually is enough.
Thank you so much. Thank you very much, Dr. Akiko.